Okay, so we've got a whole bunch of research on reactions to these mRNA COVID-19 vaccines. So
Oh, yeah.
let's jump in and
Let's do it.
we'll be comparing like Pfizer versus Moderna
Okay.
and seeing how like a previous COVID infection kind of changes things.
Right.
And the really cool thing is this is all based on those big studies, not just the early trials.
Yeah, that's important because real world data,
Right.
it just gives you a much broader understanding of how these vaccines affect people.
Exactly. Our first stop is this study on healthcare workers in Barcelona, published in the journal Vaccines.
Okay.
And get this, one of the things they found
Uh-huh.
was that people who had already had COVID,
Yeah.
especially if they were hospitalized, they reported way more reactions after getting vaccinated.
Interesting.
We'll dig into why that might be later.
Okay.
But first, let's compare Pfizer versus Moderna head-to-head.
All right. Sounds good.
So this study
Yeah.
found that Moderna had like a significantly higher frequency of reported reactions.
Hmm.
And this was true for both doses.
Interesting.
Yeah, so after that second dose,
Okay.
70% of people who got Pfizer
Yeah.
reported any kind of reaction at all.
Uh-huh.
But for the Moderna folks, it was a whopping 92%.
Wow.
And it gets even bigger.
Okay.
When you look at who needed to take medical leave after that second shot,
Yeah.
only 11% for Pfizer,
Okay.
but 26% for Moderna.
Wow. That's more than double.
More than double, yeah. No one wants to feel so crummy they can't even go to work.
Right. Right.
It's interesting, though, right?
Yeah.
They both use that same mRNA technology,
That's right.
but there's this difference.
Yeah, what's fascinating here
Mm-hmm.
is that they're both using the same basic technology, but there's still this discrepancy.
Right.
So it raises the question, what else could be going on here?
Well, the study authors, they have a few ideas.
Okay.
So first up,
Mm.
Moderna's mRNA dose is higher.
Oh, okay.
Makes sense, right? Like a
Yeah.
stronger dose of anything
Yeah.
might have a stronger effect.
Exactly.
Yeah.
Exactly.
Then there are these things called lipid nanoparticles.
Okay.
Those are like tiny particles that help deliver the mRNA into your cells.
I see.
And it could be that those are a little different between the two.
Interesting.
Plus, even like slight variations in the manufacturing process could play a role.
It's amazing how those little details can sometimes make a big difference.
Totally.
Yeah.
So more research is definitely needed to really pinpoint what's causing that difference.
Agree.
Now let's get to the really interesting part,
All right.
the impact of having COVID before vaccination.
Okay.
This is where the data gets really wild.
All right. I'm intrigued.
So they found that if you'd had any symptomatic COVID,
Uh-huh.
doesn't even matter how bad,
Okay.
you were more likely to have reactions than someone who never got it.
Interesting.
But get this,
Okay.
for people who were actually hospitalized with COVID,
Yeah.
almost all of them,
Real?
96%,
Wow.
experienced some kind of reaction after the second dose.
Wow. That is significant.
Yeah, the types of reactions.
Yeah.
They were different for this group, too.
Okay.
Like fever, that was way more common for them.
Hmm.
So it's like
Yeah.
having COVID before,
Right.
especially a bad case,
Mm-hmm.
it really seems to be tied to how you react to the vaccine.
It definitely suggests that the body's immune memory
Yeah,
from having COVID
right?
is somehow, amplifying the response to the vaccine.
Right. It's almost like your body's like, hey, I remember this,
Exactly.
which makes you think, right?
Yeah.
Like, should doctors be taking your past COVID infection into account
That's a really interesting thought.
when they're talking to you about what to expect from the vaccine?
Yeah, it definitely warrants further consideration.
Now, one thing to keep in mind,
Okay.
if you had COVID but never had symptoms,
Yeah.
it didn't seem to make much of a difference.
Mm.
It was really those who actually felt sick.
Right. So it further supports the idea that your body's immune response is playing a key role.
Yeah, it's all connected.
It is. It is.
Okay, so that's the main stuff from that first study.
All right.
Now, let's switch gears a bit
Okay.
and look at some other research articles you gave me.
Sounds good.
These are focused on the rare, but thankfully really uncommon adverse events.
Right. And it's important to emphasize that the majority of people
Of course.
will only have those mild temporary side effects.
Exactly. It's all about weighing those risks and benefits.
Right.
And the data shows that the benefits of getting vaccinated,
Yes.
they way outweigh any risks.
Absolutely.
But these studies are still important because they help confirm some of those known rare side effects
That's right.
and also highlight areas where we need more research.
Yeah, because ongoing research and data collection, they're so crucial to getting a really complete picture of the vaccine's safety.
It's like we're building a giant puzzle piece by piece.
Exactly.
Now, one reassuring thing,
Okay.
even with those rare side effects,
Yeah.
The risk is usually higher after actually getting COVID
That's a really good point.
than after the vaccine.
It is. It's all about that relative risk.
Yeah.
The chances of getting really sick from COVID itself
Right.
are just much, much higher than the risk of a serious reaction to the vaccine.
Okay, well, we've covered a lot of ground here,
We have.
but let's dig a little deeper into the timing of those rare side effects
Okay.
and what they can teach us.
Sounds good.
We'll do that after a quick word from our sponsors.
So the research shows that most of these really serious reactions, they happen pretty quickly after you get vaccinated.
Oh, really? Like, how quickly are we talking?
Yeah, so it looks like somewhere between like 77 and 89% of these rare adverse events.
Wow,
They all happen within the first week.
the first week. So if you're going to have one of these rare reactions,
Right.
it's going to show up pretty fast.
It seems that way.
Now, is there any difference, like, between the first dose and the second dose in terms of when these things happen?
There can be, yeah.
Okay.
So for example, myocarditis, that inflammation of the heart muscle
Right.
that we talked about before,
Yeah.
that was reported more often after the second dose of the mRNA vaccines.
Okay, so that second shot, it might carry a slightly higher risk for those rare heart problems.
Potentially, yeah. But again, it's really important to remember that the overall risk is still super low.
Right. Perspective is everything.
Exactly.
Okay, what about other rare side effects? Any patterns there?
Well, studies have shown that Guillain-Barré syndrome, which is that neurological condition,
Right.
the risk of that was actually higher after the first dose of the AstraZeneca vaccine.
Interesting. So different vaccines, different timings.
Exactly. And this is why it's so important that we keep monitoring
Yeah.
and researching.
Right.
We need to keep tracking these trends to see how they evolve over time.
Yeah. Makes sense. Like, we're constantly fine-tuning our understanding of these vaccines as we get more data.
Exactly. That's how science works. It's a continuous process of refining and discovering new things.
Before we wrap up, I'm curious, were there any specific age groups that seemed to be more at risk for these rare events?
Studies did find that there was a higher risk for folks age 65 and older.
So it sounds like older people need to be extra cautious that first week after vaccination.
Yeah, I think it's a good idea for them to be aware of the potential risks and if they experience anything unusual to contact their doctor.
Absolutely.
Yeah.
So we've covered a lot about when these rare events happen, the differences between the doses, and how age plays a role.
We have.
But how do we take all these insights and give our listeners some practical advice?
That's a great question, and that's what we'll do right after this.
All right, so we've spent this deep dive looking at all this data on reactions to those mRNA COVID-19 vaccines. And like we saw, Moderna, it seems like that might lead to more noticeable reactions compared to Pfizer.
Yeah, and if you've already had COVID-19, especially like a really bad case, it seems like those reactions can be even more intense.
But the important thing is that those reactions are usually mild, they go away, and the protection you get from these vaccines is so important.
Absolutely. It's about weighing the benefits against the risks.
Right.
And the benefits of getting vaccinated, they really outweigh any risks.
Okay, so how do we take all this info and give our listeners some practical advice? Like, what does all this mean for them?
That's the key question, right? How do we make this information actionable?
Exactly.
Well, I think first and foremost, don't let the fear of side effects stop you from getting vaccinated.
Right.
The benefits, like we said, they far outweigh the risks.
Yeah, but let's be real. Side effects can be a drag.
They can be, yeah.
So what can people do to make the experience a little easier? Maybe minimize those side effects.
Well, if you're worried about having to miss work or having to cancel plans, maybe think about getting the Pfizer vaccine.
Okay.
Because it seems like there's a lower chance of getting those really intense reactions that would make you have to take time off.
That's a good point. And I guess if you're someone who tends to get, achy or feverish after vaccines in general,
Yeah.
maybe have some pain relievers ready.
Yeah, have those handy.
Yeah, maybe a cozy blanket or two.
Absolutely. And don't forget to stay hydrated.
Oh, yeah. That's so important.
Drinking plenty of fluids can really help with some of those uncomfortable symptoms.
So true. And when you're scheduling your appointment, try to pick a time that allows for some flexibility afterward,
Good idea.
just in case you need a little time to recover.
Exactly. And I think it's important to remember that everyone's different.
Right.
What one person experiences as a mild reaction could be totally different for someone else.
Totally. It's all about listening to your body and giving yourself permission to rest if you need to.
Absolutely. And of course, if you have any concerns at all, talk to your doctor.
Yes.
They're there to help you through this and make sure you're feeling your best.
Absolutely. And if you do happen to experience any of those rare, more serious side effects, don't wait. Seek medical attention right away.
Definitely, in those cases, prompt medical care is key.
We talked about how having had COVID in the past, especially a severe case, can really change how you react to the vaccine.
Right. It's like your body's already had some practice fighting off the virus.
Yeah, exactly. So it's more prepared.
Exactly. So if you've already had COVID, don't be surprised if your reaction to the vaccine is a little stronger than you might expect.
Okay.
It's actually a good sign. It means your immune system is working the way it should be.
Well, that's reassuring to hear.
So we've covered a lot of ground today.
We have.
We talked about the differences between Pfizer and Moderna,
Yep.
the role of prior COVID infection, and some tips for managing those potential side effects.
Right. And the main takeaway is that while side effects are possible, they're usually mild, they're temporary.
And the protection you get from these vaccines, it's so crucial.
Well, if you found this deep dive informative, share with your friends, your family, anyone who might find it helpful.
Yeah, spread the knowledge.
And don't forget to like, subscribe, and watch our next video for another deep dive into a topic that matters to you.
See you next time.
Until then, keep exploring.